the 15 minutes allotted for our side under the executive nomination, and that when that 18 minutes is up, the remainder be, following the time on the Democratic side, the nomination be reported.
Without objection.
Thank you. I wanted to spend a few minutes as a physician who's cared for Medicare patients for 25 years. I can't tell you how worried I am about what this bill is going to do to my senior patients. You know, when Medicare was first written, two things were put into the law. Very straightforward, very direct. And let me read them to you for a minute. And I hope America listens to this, because here's what the law is. And CMS is breaking the law today, and with the new Medicare Commission, they're going to break the law even further under this bill. What this says, Section 1801, nothing in this title shall be construed to authorize any federal officer or employee to exercise any supervision or control over the practice of medicine or in the manner in which medical services are provided, or over the selection, tenure, or compensation of any officer or employee of any institution, agency, or person providing health services, or to exercise any supervision or control over the administration or operation of any such institution, agency, or person. That says the federal government can't practice medicine. That's what it says. In Section 1802, and this is where it's really important for my Medicare patients and every Medicare patient out there. Any individual entitled to insurance benefits under this title may obtain health services from any institution, agency, or person qualified to participate under this title if such institution, agency, or person undertakes to provide him such services. Well, what we have in this bill is the gutting of those two foundational principles of Medicare. The first is the Medicare Advisory Commission is going to tell you what you can and cannot have. And here's what we're going to see. You will choose what I tell you you will choose if you're a Medicare patient. Not only do we have almost $500 billion in cuts to Medicare, under the auspices that we have to control entitlement spending, not only are we taking away plans from people who are very satisfied with what they have today, but we have enhanced and will enhance the ability of the federal government to practice medicine. And my colleagues on the other side of the aisle who have never practiced medicine, who know the legalese, but don't know the consequences of right now the rationing of Medicare on drugs like Epigen and Neupogen. You see, Medicare has decided when oncologists can use those drugs. And they've taken a blanket position, although they've released it somewhat. But what it says, let me give you a patient. Patient has breast cancer. She's 67 years old. She's being treated for breast cancer. She becomes anemic and neutropenic. That means her white blood cell counts, her ability to fight infection goes down. We have these wonderful drugs that raise the white blood cell count back up and raise the red cell count back up. But Medicare, in its obvious wisdom of practicing medicine, has told the oncologists when they can and can't use it. Well, that's fine for 75% of the patients, but it totally ignores the other 25% of the patients who happen to have complicating factors like congestive heart failure. For if you become anemic under your breast cancer chemotherapy, and you have congestive heart failure as well, the government says you can't have erythropoietin at this level of hemoglobin, regardless of whether or not you have congestive heart failure or not. So what happens is the practice of medicine out of Washington, or Maryland more specifically, determines who can and cannot have a drug. And in this case, erythropoietin. What are the consequences of that? The consequences is the patient didn't die of their breast cancer, They died of their congestive heart failure that could have easily been treated had we not had medicine practiced by CMS denying the ability of a physician to give the patient exactly what they needed when they needed it. We are starting down that road with this bill, aggressively starting down that road, because the Medicare Advisory Commission, combined with the Cost Comparative Effectiveness Panel, won't look at complications, that won't look at secondary diseases. They will look at the average. And I want to tell you, when you're sitting in an office with your doctor, you're not average, you're you. And you are a specific individual with a set of factors that nobody else has anything comparison to. And the judgment in the practice of medicine cannot be done by an insurance company or CMS at a distance without them having the hand on a patient. And they never have their hand on a patient. So the whole art of medicine, which is 40% of getting people well, the knowledge and training and experience and gray hair that comes with looking at the total patient, being one-on-one, not having the government in between their doctor and their treatment of them. And what this bill does, this bill is a lie one of two ways. One is it says we're going to take this money and out of Medicare, and you're not going to notice any difference. That cannot be true. If we take $500 billion or $400 billion plus out of Medicare, millions of seniors are going to notice a difference in their health care and what they get under Medicare. And if we say that isn't true, then the only way that isn't true is the game that's being played on the financing of this program. And that's to say we're going to cut this money out of Medicare and then with a wink and a nod know that we're never going to do it. Now, the majority leader said yesterday, there is nothing more important in this nation right now than us passing health care. I want to differ with that. I think 10.2% unemployment is a whole lot more important in finding those people jobs than us passing health care. I think a $12 trillion debt is more important to address than us fixing health care right now. I think the fact that we have $350 billion worth of waste, fraud, and duplication in the federal government every year and we're not addressing it is more important than fixing health care right now. I think the fact that our economy is still on its back and people are continuing to lose jobs is more important than us fixing health care right now. Now, I understand the political dynamics, but I also understand very well, with my quarter century of practice in medicine, that what this bill is going to do is going to destroy the best healthcare system in the world. And it's going to undermine the security of every senior in this country, because what starts as a small couple of things like Neupogen and Epogen, or like when you can have bone densitometry, and whether or not your osteoporosis can truly be evaluated. CMS has already said how often you can do that, whether or not your bones are falling apart or not. It's the start of the government practicing medicine. It is the beginning of our seniors to have the government step in between them and their physicians in terms of the physician wanting to do what is best for that senior and the government saying, no, I'll tell you what you're going to have. I will tell you what you will have. You know, Thomas Jefferson taught us a lot. And he predicted that we would have future happiness for us if we can prevent the government from wasting the labors of the people under the pretense of taking care of them. I want to see a lot of things changed in health care. I want to see true competition in the insurance industry. I want to make sure nobody loses their insurance because they get sick. I want to make sure everybody can get insurance if they are sick. I don't disagree with the basic premises. What I disagree is moving $2.5 trillion more under government control, which will raise costs ultimately in the healthcare sector. And if it doesn't raise costs, and we're truly going to take this money from Medicare, what it's going to do to our seniors is I have a message for you. You're going to die sooner. And they're going to go, "Gas, that isn't true. That isn't true." When you restrict the ability of the primary caregivers in this country to do what is best for their senior patients, what you are doing is limiting their life expectancy. We are saying that CMS, the Medicare Advisory Commission, and the Cost Comparative Effectiveness Panel will tell the doctors what they can and cannot do, ignoring the 20% of the people that is exactly the wrong prescription for. So for 20% of our seniors, this bill is going to be a disaster, but it's going to save money because you're not going to be around for us to spend any money on you, because the government will have already told us what the treatment plan will be for you. We will decide in Washington through the Center for Medicare and Medicaid Services what you will receive. Now, they'll dispute that, but the people that's going to be disputing that are lawyers. They're not doctors. They've never laid a hand on a patient. They've never put their hand forward on a Medicare patient knowing the consequences of the whole total patient, the background, the medical history, the sociologic factors that fit, the family dynamics, the past medical history and the family history, and the present state of mind of that patient. And even more important, what this bill is going to do is divide the loyalty of your doctor away from you. No, when you go to the doctor today, most of the time, that doctor's number one interest is in you and your well-being. And when you have this Medicare Advisory Commission and you have the cost effectiveness, comparative effectiveness panel, what that does, that causes the physician, he or she, to take their eyes off of you. Now they're going to put their eyes on what the government says, because the consequences of not doing what the government says will ultimately result in some type of sanction. So, do we want physicians to be patient-centered and focused on their patients? Or do we want physicians to have their eye on the government and half of an eye on the patient? Which do you think is going to give us the best care? Which do you think is going to give us the greatest quality of life? What's going to give us the greatest longevity with the greatest quality of life? Is it the government practicing medicine? Or is it the trust that has been developed through years between a patient and a doctor to do what is in the best long-term interest of that patient? I can't tell you the number of people that died from the Medicare CMS regulations on Epigen for oncologists. But there were hundreds. Hundreds. Because Medicare never looked at a patient, they looked at dollars. So as we go forward in this debate, what I want seniors in America to know, and I'm fast approaching Medicare age, I'm 3 years from it, I want them to know that the key thing they're going to lose in this bill is they're going to lose the loyalty and primacy of their physician thinking about them. And we're going to divide that loyalty to where the physician's going to be looking at the government. And if you think that isn't true, just look what's happened so far when CMS has decided to start practicing medicine. In the Help Committee, I offered an amendment to change the language so that there would be absolutely a prohibition on rationing care and directing the care from Washington. It was rejected out of hand. Rejected out of hand. Not one of my colleagues on the other side of the aisle voted to prohibit rationing of health care. Now, why would they do that? Because the ultimate intention through the Cost Comparative Effectiveness Panel is to ration care. It's to ration the care. It's to limit the amount of dollars that we spend and never look at the individual patient. If we think about the Medicare cuts in this bill, we're going to take $135 billion out of the hospitals. Do you think seniors will ever notice that? I do. I think when you ring your button and you're hurting and you need pain medicines or you need to go to the bathroom, the time it takes for somebody to get there won't be sufficient. What will happen is you'll wait. You'll have a complication. If you become acutely shortness of breath and you punch your button, the available nurses won't be there. So there'll be a consequence to cutting $135 billion from payments to hospitals in this country. We're going to take $120 billion out of the seniors, the 1 in 5 seniors who now have Medicare Advantage. I agree, it's more expensive than Medicare. It needs to have some cost containment through competitive bidding. But we shouldn't be decreasing the services, which is exactly what's going to happen. So if you're a senior on Medicare Advantage, you're going to lose benefits that you now have. You're going to lose them. One of the ideas of Medicare Advantage was preventative services. One of the things that improved the care in rural America was Medicare Advantage. And yet we're going to take that away. The vast majority of the benefits. We're going to cut them in half. We're going to take $15 billion from nursing homes. That may or may not be appropriate, but the way to do that is through a competitive experience based on quality and outcome, rather than some green eye shade staffer saying we can take $15 billion out of Medicare from payments to nursing home. You know, one little secret that's not in this bill, that has not been addressed in this bill, is the estimate by a Harvard researcher that there's $120 to $150 billion a year in fraud in Medicare alone. HHS admits to $90 billion. We know it's well over $100 billion. $100 billion a year in cleaning up the fraud in Medicare would pay for a lot of health care for a lot of folks in this country. There's $2 billion in this whole bill to clean up the fraud. Why would we not fix that first? Why would we take money from Medicare to create a new program when in fact we're wasting 10 to 15%?
Senator's time has expired.
I will close with this remark. If you're a senior and you're on Medicare, you better be afraid of this bill. I don't come to the floor and say that very often, but your health care is totally dependent in terms of being decreased by this bill, and I yield the floor.
Madam President.
Senator from Connecticut.
Madam President, I would ask consent that I be allowed to speak for 1 minute and 7 seconds at the time